Impact of homeopathy in adnexal masses of females, a descriptive retrospective study.
Thank you, Dr. Partha. Good afternoon to all the dignitaries on the dais and off the dais, and I will not take much of your lunch time. Yeah, as the topic says, the impact of homeopathy in the adnexal masses of females, a descriptive retrospective study. So, just about the line of the topic, that what is adnexal masses? It is one of the most gynecological problems which are actually related to the growth next to uterus, most commonly arising from ovaries, fallopian tube, or surrounding connective tissues, and are mostly benign as suggested by large population-based studies. There can be various pathological causes, like starting from leiomyomas, ovarian fibromas, and other lesions, and which can be detected by history, either by physical examination, ultrasound evaluation, and certain important laboratory tests, especially CA125 related to ovary. Next, the retrospective study can be basically descriptive of or analytical in type. If it is a descriptive retrospective study, mostly case series comes under it. And if it is of analytical type, then either the cross-sectional studies, the case control studies, or the cohort studies which comes under it. And hurrying to the cases, this is the first case which is from the OPD of Dakri. And before I go into the cases, just very basic thing. Whenever you have cases related with adnexal masses, the most common presentation will be there some kind of pain or discomfort or a pressure sensation in the lower abdomen, mainly maybe either in the left or the right. So similarly, the first case presented with the pain in the left iliac fossa for 3 months, along with the associated symptoms was there, which was pain in the lower limbs with numbness, which was aggravated during walking. And there was a low back pain as well, which was aggravated during rising from the sitting posture. The USG, which was done by the patient 10 days ago just, and which revealed that the left adnexal asoil was there, possibly of a left ovarian origin, and the asoil was of mixed echogenicity, noted at the left adnexia with features of internal septation, and was around around 4.3 to 3.9 centimeters. The right ovary, however, was normal, and CA125 was also within the normal limit. This is the investigation report, as I just said, and in this case, there was not much in the generalities, and I have to focus with 2 or 3 symptoms, which was basically the particular symptoms, and I, on a basic of keynote type of prescription, followed by reparation. I went with this basic 3 symptoms, and Thuja was the outcome in the repertorial sheet. And I started with Thuja 1M with 2 doses, and this was the follow-up. And within a span of 4.5 months, this was the result. You can see on the right hand side, the study USG reveals that no more lesion, no more adnexal mass was existing, and it has been cured. The patient was cured not only through radiological investigations but also through the symptoms. Patient was absolutely, totally symptom-free, disease-free. The next case again, this was related to another OPD case in Dakri. It was with a pain in the right iliac fossa for 6 months. USG was done by the patient 3 months ago, and USG report showed that the right ovary was not visualized. Instead, a cystic asoil, which is around 4 centimeter to 3.89 centimeter to 3.83 centimeter, noted at the right adnexal. Left ovary, however, in this case was normal. Along with that, there was a calculus noted at the lower calcial region of the left kidney. Generally, we Huvicans basically claim to be masters of kidney stones, but very often problems arises when the stone is located around the renal pelvises or the renal parenchyma. This stone was of 6.1 centimeter and located at such situation. This was the symptomatology. The pain in the right iliac fossa, which was basically aggravating during menses, and it was a pressing type of pain. Pain with the burning sensation was there during urination. Probably this may be due to the stone in the background. Cannot tolerate empty stomach for even for more than 1 to 2 hours. Menstruation was regular, but the flow was scanty. Desire for shower. Feel sleepy but cannot sleep. And drowsiness is present all throughout the day. There was also a history of cholecystectomy and in the few years back in 2014. So there are so many students here. Anybody can guess the drug? Anyone? Okay. So I'm coming to the drug. Till then you just keep guessing. This was the USG, and this is the drug after the repetition, and it was pulsatilla. So pulsatilla, as per the Kent repetition, which was used by the HomePath software, and this was the prescription. 2 doses again of pulsatilla 1 mg, and this took a lot of time, around 1 year, more than 1 year, 12 months, and ultimately even I have to pass to pulsatilla 10 mg at some point of time during the follow-up, and ultimately this was the result. It was not only the Adnexal which was totally cured, but the stone also not there, and this was a constitutional prescription of pulsatilla which cured both the pathologies in the background. Now, the next and the last one, that is the case 3, which is again a case taken from OPD in Dimapur, Nagaland. This is a dull pain in left iliac fossa, and the bleeding per rectum was also an associated symptom for the patient. She also had a sensation of lump in the right iliac fossa, but the pain was more felt in the left iliac fossa. And USG revealed that there was a complex cystic lesion of size approx 50.5 to 42.7 to 44.4 millimeter, means it's almost the 5 centimeters kind of mass with a few fine septations. And in the left side, there was some significant anechoic fluid in the pouch of Douglas and in the left adnexal region. There was a confusion in the report. There was a question mark that it may be some kind of hydrosalpinx as well, along with the right adnexal cyst. So this was the report, and this was the whole history taking. There with a lot of generalities, past history, family history. There was a lot of things to evaluate in this part. And this is the symptomology. Anxious about her siblings' health, lack of confidence because of her health issue, ailments from grief, appetite diminished, sensation of a lump in the right lower abdomen, pain in the left inguinal region and the iliac region, and the modalities were the warts, one on walking and lying on the left side, stool receding back, bleeding per rectum during defecation, and the burning pain in anus during and passage of the stool, and the patient was a chilly patient. And preparation was done using the complete repertory, using HomePath software, and Thuja was the prescription once again, and Thuja cured the case within a span of 2.5 months. Within 3 months, the case was cured, and this was the nutshell which I want to show you. That this is the analysis. This was the 3 cases which came with a complaint of 3 months, 6 months, and 1 month, but ultimately for cured within 1 year. All the cases were cured, either with Thuja or pulsatilla in this case. Basically, it was constitutional drugs, basically most of the time used, and the cystic SOL, more or less in all the 3 cases, were within 5 centimeter or 50 millimeter. So what is the conclusion? Conclusion is this, that retrospective studies, which here we had some case series, which actually helps us to gain the concept of some prospective studies in future, and we can design prospective study designs, clinical trials based on these retrospective studies. And this one more evidence is that obviously it's a adnexal mass which has a good response from homeopathy, and that has been evident in these 3 cases. So with this I conclude myself, and thank you. Thank you all.